This meeting is being recorded.
Greetings, everyone. My name is DJ Wells. I'm the Executive Director of the Mensah Research Institute. Thank you for joining us for what is, again, part of our ongoing series, our series that stems from the Integrative Mental Health Summit that we started back in October. We're very excited that you're able to join us here today as we continue that conversation, keep things going, and also lead into the second annual Integrative Mental Health Summit, which we will be hosting again in this upcoming October. So looking forward to a great conversation today. We've got several distinguished panelists to share with you a conversation about the difficulties and the challenges that many underserved populations experience as they navigate the mental health space. And so with us today, we've got Mr. Jeff Maupin, who's a businessman and an advocate and a resident of, I hope I'm saying this right, Barrow, Alaska, which is a Native community in Northern Alaska. We've worked with Jeff for several years, and he shared with us several of the difficulties that Native Americans and other underserved populations face up there in Alaska. And so we're going to ask him to share some of his perspective. We've also got with us Dr. Don Feeny, who is a staff psychologist, I believe, at American Indian Health Services in Chicago. And that's an interesting part of this conversation, I think, because many people aren't aware that there is a thriving Native American community in many of our urban areas. And so Dr. Feeny have a lot to share in that regard. We've also got with us Dr. Trish Perez, who several of you may remember was a presenter during our first Integrative Mental Health Summit. She is an expert in international psychology and is on faculty of the Chicago School of Professional Psychology. So she'll be able to bring that international psychology perspective. So I've given enough background information. I'm going to hand things off here to Dr. Mensah very shortly. And he's got one other panelist that he's invited who can share a kind of a, where the rubber meets the road conversation about this issue. I should point out before we go any further though, I should mention that Dr. Mensah and I both also have a little bit of skin in the game here, and that Dr. Mensah is the medical director at American Indian Health Services in Chicago. And I, before joining Mensah Medical, used to run the urban health program at the University of Illinois, which is a program that focuses on addressing health disparities in underserved communities. So lots of people with lots of perspective here. I'm sure this is going to be a very rich conversation. Dr. Mensah, if you wanted to introduce our final panelists, then please take it away.
All right, well, thank you, everyone. First of all, I'm really excited to have this wonderful team of experts, both by way of life and by way of profession. Dr. Feeny, Dr. Perez, thank you so much for coming. We value your perspectives and so forth and all of this. Originally our panelists were going to be fairly finite, and then it just so happened that this past, I think it was Thursday or Friday, I was speaking to Serena, and she shared with me her story, and my mouth dropped. And I said, this has to be told. So instead of the usual didactics and typical progression, Serena, I'd like you to tell your story. I want you to share with everyone what you've been through and introduce yourself. So please, Serena, go ahead.
Thank you, Dr. Mensah. Thank you, Dr. Feeny. Thank you, panelists, for allowing me to come and share my story here with you today. I am a relapse recovery peer support specialist here at the American Indian Health Services, and I've been here since the end of October. So I just started here with the clinic. But my story entails lived experience as an active addiction for 39 and a half years. And I grew up in the streets of Chicago on the north side of Chicago. I just turned 51. So, I had access to all the wrong things, all the bad things. I was a leader as well as a follower. I had 4 children as going through my upbringing, and as I became an adult, moved around a lot. And 7 years ago, I lost my daughter to suicide. She was 24 years old. She was also following the same characteristics as her mother, as an alcoholic, started to dabble into some drugs. And then when I came home from work, I found her in my room. She was unresponsive. So I really spiraled at that point where I really went into deep, dark depression. And I was a nurse, mind you, for 27 years. Throughout this time, I lost my license when my daughter passed. I started to use opioids where I had access to get them, the DEA numbers, things like that, and had people help me do it. I've been in recovery now, though, going on almost 3 years, and it's been a steady chase. It's been a hard journey for myself, but I take it one day at a time. And throughout that time, what really happened was the dysfunction was at home when I was a child, a youth, of the sexual lateral abuse that I saw with my parents, or the affliction that was on me when I was a youth from the age of 5 to 11. And so those things had happened, and those is what led me to the alcohol and the drugs and things of that nature, because of the numbing. It wasn't no longer about being a party. It was that numbing feeling of to just get that out of there, to get my head out of my own, to stop me from thinking. So I was a functioning alcoholic as well as a drug addict. I had many jobs. Again, I was a nurse for 27 years, a bartender for 23. So in the evening, I would go to the bar and go work, but I'd end up drinking and, sitting there and, doing what I did best. And that was to get drunk, go home, go to bed, get up, go to the hospital. So, but I don't really like to focus when I tell my story about the bad things that happen. What I like to focus on is the good that I'm doing now today and the opportunities that I have to help others. And so when I first started my recovery journey, I learned about these teachings, the medicine wheel. Now I know about them. I'm indigenous. I'm a Chiricahua Apache in Oglala, Lakota. And I knew about the traditions and the ceremonies, but didn't practice them. I wasn't really around the family. I was trying to get out. It was always conflict and chaos. So I ended up carrying it throughout my journey of my life, through my 20s and my 30s and my 40s, until when I turned 48. I was getting out for work at a bar, and I ended up crashing my car. I had a truck, and my truck wrapped around a tree. Thought I saw 4 deer at this time, and so as I swerved my truck, it wrapped around the tree and turned into like a seed. So I didn't know what happened when I came to. I just knew that I was really sore on the right side where my body had hit the side of the what do you call that thing there? The divider between the passenger seat. And when I took my seatbelt off, I fell, and I fell to the passenger side window. So I stood up, and I didn't know where I was. I was pretty inebriated. And I started honking my horn. It was pitch black. It was about, when I came to in the hospital, it happened about 4:03 a.m. So I'm driving home, pretty out of it. And I was taking opioids. I was drinking alcohol. I was doing other stuff too that I'm not proud of, but it was what I did. And I was it seemed like it was like maybe a half hour to an hour, but coming to realizing as I started to learn about what really happened, it was only 2 minutes from that time where I found my phone. I called the 911, had the ambulance come. So it all happened within a 20-minute period, but it felt like it was 2-3 hours. And I was just beeping the horn for people to hear me, flashing my lights, and so they had to pull me out with the jaws of life because of how damaged the truck was through the windshield. And when they pulled me out, I just laid my head in the ground and I cried, and I asked Creator to help me to save me, that I couldn't live this life anymore. I'm a very spiritual person, and so at that point when I surrendered, I felt that emotion, and I started crying. And I cry when I tell the story because it was a rough road. Losing my daughter really put me down, really. But the work that I'm doing today, after all of this has happened, and the journey that I've been on has been for this reason. It's to help other people, other Indigenous people, other children, other youth, educate them, give them the teaching, show them traditions and ceremonies, and how to live a healthy lifestyle. Because it's not just a 30-day period, 90-day when you're in treatment. It's a lifestyle that we have to live. And I have to continue to do that so I can be there for other people. And I was gifted this opportunity here at the American Indian Health Services to just do just that. And I work with a bunch of wonderful people, and everybody, some people know my story and some people don't. It's selective, I guess. And I guess I still surprise people when I tell my story. So, because then, then I get invited to these webinars. So, but the ultimate goal here is what I try to do is the teachings that were taught to me. I tell my clients, my patients, I advise them, suggest to them, and never make them do anything they don't want to do, but to do it one day at a time. And to know that they are not the only ones. They're not alone. They've got somebody who's been there, who's lived the experience for so long, who really understands what they're going through. And I think having that peer-to-peer support, and looking at each other as an equal, and don't disrespect any professionals. It's just we understand, the hardness of where that came from, and we can relate. So, it's something that we have to overcome, and some of us don't make it. Some of us Indigenous folks don't make it. I just lost a niece early in January to the missing murdered Indigenous women. Well, not to that, but she is missing. We don't know what her story is. We did find her remains. And that's also another thing that I do, because our reservations need these kinds of programs, these intense outpatient programs, or these mental health programs, or, we need to protect our children, the next generations, and the next 7 generations. And I think it's important. And so I take much pride in the work that I do and try to be the best at what I can do to help others, but I keep it real too, because they need that. They need that realism. They need to know that, you're going to have good days, or you're going to really have some bad ones too. So, and then those are the days that you really need to reach out and talk to somebody. You really need to get that help. And so with this program that I'm doing, the Medicine Wheel 12 Steps here, I have that privilege of showing them how to live a well-balanced life mentally, physically, emotionally, and spiritually, by teaching
Serena,
them new habits. Yes.
Serena, it's one thing to talk about recovery, and oftentimes when we hear these stories, it sounds like a very simple linear path.
Right.
You said something last week that blew me away, and I want you to tell everyone, how many times did you try to do this, and how long did it take you to actually succeed?
Actually, so in the process of the 39.5-year active addiction, it took me 9 times. This is my 9th time. This is my 9th time. This is my last time, because I've implemented the spirituality aspect, the physical, the mental. I'm covering all avenues of everything I need to keep myself in that well balance. I believe that was the change, because I tried NA, I tried AA, but the spiritualism of my teachings and my traditions and my culture really implemented that, really opened that up to get that healing, to understand the intergenerational trauma from past lineages that carries into our blood, learning all of that stuff. So it's an ongoing journey. It's still an ongoing journey. And, I always keep myself open-minded and remain teachable, because that's the only way, and stay humble. Never think I know more than anybody else does, because then I won't learn. That's when I'll hit those brick walls. But it's an ongoing journey, and what we need to do is implement programs that help them, teach them healthy habits, a healthy lifestyle after the fact, to change that stinking thinking, that's what we call it, and put good habits, good self-talk, turn it inside out, show them other avenues. And it's important. And we need to get, those things, and so that we can provide to our people, and everybody's that's going through this, but more so our Indigenous folks, because they carry a lot of pain from our ancestors.
Serena, thank you. Thank you so much for sharing that story.
Yeah,
You
thank
guys got
Serena.
a glimmer. I heard a lot more over time, but I had to bring her into focus. Mr. Maupin, Jeff, how are you? Serena's story is powerful, but it's not quite so unique, is it?
No. In Indian territory, tribes, we are facing mental health challenges worldwide. And our region up here, for example, has the highest suicide rate in the nation, unfortunately. So I'm excited about the effective treatment that Mensah Medical offers, and I'm trying to make it known to tribes, because tribes across North America can greatly benefit by learning about the effective treatment that Mensah Medical offers.
Well, Jeff, I appreciate that. I want to share with you now the collaborative work that we're doing with the entire world of international psychology, the American Indian Health Services, and Mensah Medical and the Mensah Research Institute, and all institutions and therapists everywhere, because this is not simply unique to one people or to one state or wherever have you. I was shocked all the years I've been in Chicago. I did not realize there was a Native presence in Chicago until 2 years ago. There are 50,000 natives in Chicagoland.
Wow.
And I sat here dumbfounded to find out that statistical piece of information. And when we think and we talk about natives, we're using this as one umbrella. That's like saying that you have all Africans or all Europeans or all Asians. There are well over 75 minimum different tribes, forget cultures and subgroups and subcategories involved here. And Serena, please feel free to give us a real number. But all of these individuals, all of these groups, very unique cultural histories, and tending to those elements, those pieces, is very critical. But before we can do that, we have to be able to identify them. I would always say, well, I'm from Ghana, West Africa. And people would say, well, I didn't know there are Ghanaians in Chicago. I say, oh, there are over 30,000 Ghanaians in Chicago. And then I sit here and I find out there are well over 50,000 Native Americans in Chicagoland. I had no idea. Dr. Perez, international psychology. This is what we're talking about here. Trish, give us some discussion here on what Serena's been through and how this applies certainly globally. How do you work through this kind of a process here? How do you see this, Trish?
My goodness, that's a really big question, and
I'm just
I'm just thrilled to be in this space, knowing that I'm from the Philippines, and I'm not of the culture that we're speaking to. So thank you so much, Serena, for your lived experience and story. So I think from a starting point, a lot of what Serena said and what Jeff has said already, Serena, you sound like one of our international psychology students, because this is where you're at right now is exactly how we teach our students. So with being open, being curious, being a lifelong learner, and coming at it with humility. So we teach our students that, because you can only imagine in the international space, no one can be a master of any culture, right? Nobody can be a master of any context. And so I'm just going to step back for 1 second, Dr. Mensah, and just define a little bit what international psychology is, and then link it to some of the clinical work that I do globally, and also how the orientation is, because it's very much of what Serena was talking about. So in a nutshell, although there's much longer definition, international psychology is really thinking, feeling, and behaving, which is like a very, I would say, just a very short version of what the field of psychology is in a global context. Okay, so it doesn't matter. It doesn't mean like we need to live somewhere else in a different world, different country or something like that. We have diversity here within the United States, right? We have all of these different groups. The second part of international psychology is that we recognize that the application, understanding, examination, and also research of psychology is not not always Western based, okay? And so when I talk about Western based, I'm talking about groups that are dominant and who oppress. Okay, so Serena, when you were talking about from your ancestors and things like that, and we're not going to have a history lesson here, a lot of our teaching in international psychology, and when we think about things like trauma, is the whole idea that it's contextualized of how we define trauma, where that trauma is coming from, and the similarity across many vulnerable and marginal populations, whether they're native or not native, is a fact of things like colonization, who has and who does not have, who oppresses people, for example, who doesn't allow or recognize indigenous or healing from the culture. Okay, so this is what's so fabulous. I feel quite blessed and privileged, actually, I must say, to be able to be faculty in this department, because we get to flip the narrative of understanding and then breeding the leaders of tomorrow to not to really not look at other models that don't work, like that don't work for the culture. So Serena, a lot of the things that you said, working towards well-being, resiliency, things like that. But again, like the things that you were talking about, like the ceremonies and rituals, like I think that gets lost with our youth. Our youth are losing just even the traditional things for, I don't know, Western, whatever, like Coming to America, or like things that they see in the movies, right? So then there's a disconnect between healing in the traditional way and what's maybe cool or not cool to then what's out there. And that's where people like ourselves, who are professionals, practitioners, supporters, medicine, all of that can come together in a collaborative fashion to be able then to support, rooted in the context of the community. Because let's just say, like where Jeff is, may or may not be similar population to mental health and well-being than in the Chicagoland area. Okay, so we can't cut and paste, right? We can't cut and paste. And Dr. Feeny and I were just talking about, we both were trained at Loyola University Chicago in counseling psychology. I had a minor in multicultural counseling, so there seems to be a lot more synergy here.
Oh, interesting.
Right? Yeah. So we can't like cut and paste and say this theorist or this person in counseling psychology is going to be the blueprint for our treatment plans or things, right? I mean, it really is, I would say, and sorry, I'm taking up a lot of time. I'm going to stop from the bottom up, like from the bottom up, right? So usually I used to have a 11-year psychotherapy practice in the northern suburbs in Chicago, because I'm in Chicagoland as well. And many of my clients were not considered of the dominant culture, okay? Asian, Native American, Latinx, LGBTQ, like, and what I usually start with is just understanding their story, right? Tell me about yourself, describe yourself. And that was the starting point, as opposed to making assumptions about what I think should happen. I wanted to see, based on their culture, based on their families, based on their communities, what they already do from a strength-based perspective, what they already do to be able to move one day at a time. Like, I'm also one of those type of people. So anyway, those are my thoughts. I mean, obviously there's just so much more, but thank you so much for letting me be in this space.
I think it's absolutely invaluable to have a representative, an esteemed representative of the International Psychology Program, because it is one of the pivotal new paradigms, as far as I'm concerned, from the old model of, well, here's what so-and-so said, and this is how it works, as you said, rubber stamped and pasted elsewhere. And it's a beautiful segue. I'd like Dr. Feeny now to chime in, because Dr. Feeny, Don, we've had more conversations that take up way more time than either one of us even planned, but absolutely fascinating regarding approaches to individualized situations, circumstances, populations, and in particular the Native population. Dr. Feeny, would you care to sort of share a bit of what Serena's been talking about, what Dr. Perez has been talking about, as both kind of coalesce into approach that you're actively pursuing and using, and really developing and designing. Dr. Feeny is actually the pioneer at the American Indian Health Services with regard to creating a new substance and alcohol recovery program. And Serena is part of that process. And it's something that, while we don't rubber stamp, I think there's some very key pieces to this that are applicable to many different populations as well. Dr. Feeny.
Sure. Thank you, Dr. Mensah. To be in such gracious and exquisite company with yourself and all of the other presenters, I am also honored to be here. I think it's wise to share the heartbreaking and the heart-encouraging story of Serena and her recovery through the trials and tribulations she's gone through. And it speaks to the human character of resilience in terms of she may be down, but she's not out by a long shot. And that spirit of recovery is powerful, especially when she gets to the core roots of her own spirituality. I'm struck by the recognition of the complex nature of individualistic qualities that are present. And it reminds me of the concept of diversity within diversity. Sort of like the Chinese doll issue. This is contained within the containers. Dr. Mensah rightly spoke to the issue that the idea of one Native American culture that we colloquially use as Indian, but actually it's Native American. There is no one tribe. There is no one representative, because each tribe has their own traditions, their ceremonies, and cultures. The endangerment of urbanizing a culture, if you will, where it becomes incorporated in an industrialized, mechanistic, objective cause and effect scientific approach, is that it will lose those roots, we lose those wings, we lose that tree of life, if you will, that we had talked about in another time, and how to reconnect. One of the hardest parts is to relevantly understand historical nature of the culture and to individualize that to each person that is present in the current here and now moment, but to connect that present, how they got here from where they came from and where they're going. Someone once said, if you don't know your past, you're going to have a hard time knowing what your future is. So the important quality of individualizing and looking at each person within that culture as an individual with their own unique complexity. It's the challenge is to contextualize, and it's a beautiful conceptual word and construct to incorporate what's the setting, what's the environment that's nurtured that individual in the first place. And one of the issues of individualizing is to understand, and this goes with the word of culture. You don't hear this too often, but in the artistic world, the term motif is something that exquisitely captures the artistic nature of a template, a design, iconic characteristic that identifies that individual, person, place, tribe, culture. The individual has their own motif. The tribe they're within has their own motif. The collection of tribes has a motif of those motifs. So you get a concentric expansion that ever diversifies, but it's still similar. And I don't mean to throw another term that may be a little bit strange here, but the term asymmetry implies that it's similar, but it's not the same, which is what the characteristic nature of individuality is all about. In our treatment programs, what we're attempting to design is a opportunity to present a multi-dimensional, multifaceted range of language modalities that involve the medicine wheel, the seven branches, seven sacred branches, in conjunction with, and I'm going to generalize the term, westernized therapy, and Tricia may understand that term in terms of classic, what I hear you saying is blah, blah, blah. The issue of incorporating the scientific with the historical traditional is what I call a marriage of language, of interchangeable terms that allows people to capture not only where they are in the sometimes the urbanized modern day moment, but also their history and their heritage, so that they can incorporate and integrate on an individualistic basis to them how they relate through their own culture in their own contextualized way, in their own individualistic motif or style of living. That is, I believe, a core issue of recovery. And you heard Serena go through the gut-wrenching experiences of the losses and how much she loved her daughter and how devastating the impact was and how courageous she was to kind of fight and claw her way back to her own stabilization. That spirituality is ingrained within that motif, if you will. And had she not gotten to a level of individualistic, personal core, shall we say, a character of what really mattered to her, that recovery would have been in jeopardy. As a matter of fact, she got in touch with that core issue. She got generated with that spiritual connection. She contextualized that with her own individuality, and she motivated herself in terms of working with the resources that helped her stay connected from a traditional and personalized involvement. So you get a marriage of the individual, the culture, that motif, and the core issues that capture that alignment. This is not an easy job to do, but it's worth doing if you can individualize and capture within that context who that person is in that particular culture, in that particular tribe, with that particular motif. And the devil is in the details, and so is the spirituality. So if you can capture that individualistic nature in that cultural setting, it's a winning combination. But if we don't, then we've lost that alignment, and recovery drags on, and you get multiple relapses, and you get multiple detoxes, and you have to start all over again. Anyway, but that's the gist of how we're approaching it. With an intensive outpatient program, we're looking at the possibility of 64 different presentations over a 4-week period, 4 nights a week, for 4 weeks. And if I can still multiply after leaving Loyola, I think it comes out to 64. Because it gets kind of touchy-feely over there, which I love, but it gets a little bit, it's right brain, not so much left brain. Anyway, but it works both ways. The thing that's interesting is that with those multiple presentations, it offers an interchangeable languaging, conceptual construction of presenting the medicine wheel, the seven sacred branches, the psychodynamic issues of intergenerational trauma and abuse, family systems, individualistic perceptions, cognitions, and how people incorporate the 12 steps and 12 traditions of AA and NA in a contextualized framework of Native American history and culture. When these are combined, you get a wonderful, and here's another fun word to play with, juxtaposition of how these dynamics work out. And I don't want to get too wordy about it. The point is, if you can capture that interface, that boundary of the individual, the culture, and the context it operates in, you have a program that drives into recovery. If you don't capture it, we don't capture it, then we're missing that golden opportunity. So I hope that gives you a flavor of what we're trying to do.
Jeff, Dr. Feeny, thank you so much. I appreciate that. That's an excellent, believe me, folks, that everything Dr. Feeny said is just the tip of the iceberg, what it is that he's trying to accomplish there at the American Indian Health Services. Jeff, what's interesting to me, you live and work with the Inuit Indians in Alaska, and Alaska of all places, not the warmest environment on the planet here. But you see so many of these individuals. When you and I have talked in the past and you talked about suicide, you talked about the alcoholism, the drug use and so forth, but there aren't interventions, Jeff. They're not the interventions and the knowledge and the availability for these types of treatment programs, which is why I found it so interesting. Mr. Maupin and I have talked about nutrient therapy to try to help correct the chemical imbalances that are there in the body itself, so that as the body heals, all the other great therapies now can kind of come into play to help the spiritual side move to the next level. And Jeff, here we're talking about now the other side of this. Do we have the centers, Jeff, the folks like the Dr. Feeny's and the Dr. Perez's available for contact, for discussion, for healing for the Inuits in Alaska?
Well, we're blessed to have a behavioral health department, division of our health department here. Our local regional government is called a borough. Other states call them counties. And they have a caring, wonderful staff. They have counselors. But like most tribes, nearly all tribes, they are unaware of the Mensah approach of normalizing nutrient levels, of incorporating blood tests as objective evidence for diagnosis and treatment of those who are in need of help. That's what I love about the Mensah approach. I think all psychiatry would do well to embrace and use blood tests to measure components, nutrient levels, and to as part of the treatment plan. And across tribes everywhere, this objective scientific approach is not being utilized, and so I've become a raving fan, if you will, of the Mensah approach, and because I want people to get help. I want people to get effective help. As you know, 20 to 30% of all pharmaceutical medications are fluoridated. I don't think we benefit from consuming fluoride. We would do much better to normalize nutrient levels. And so we would do well to read the book Nutrient Power, and we would do well to minimize toxins in our body. Doctor?
Well, thank you, Jeff. We're really rooted around, what we do at Mensah Medical, Mensah Research is what we like to call comprehensive healing. And you cannot have comprehensive healing unless you address all aspects of the individual, mind, body, spirit, and so forth. We start with the body, of course, but unless we're also working with the spirit and with the mind and with, what I loved that Serena shared And Trish, we've talked about this, Dr. Feeny, we've talked about this, transgenerational trauma, which in our world revolves around basically epigenetic trauma that is inherited through the DNA. And if we use the native population as a microcosm, as a representative of a larger group, we see how there is this inherited devastation that is so permeating these particular cultures from ancestral destruction and devastation, that it takes more than just counseling, it takes more than just biochemistry. It is an entire readjustment and reminders at a therapeutic level of who they once were, who they are, and who they need to be. And Serena pointed out so well the idea of bringing her people, that is, the people who come to see her, back into adjustment with regard to this is the direction we need to go. Here's a lady whose life was devastating. 8 attempts at recovery and sobriety, and she still struggles and admits it, but she's doing well. Her survival has allowed her to now come back and to help others, which is something that I believe, Trish, many of the stories you've encountered share the same process. People who've been successful now turn around and try to help other people. Trish, how do you kind of share that piece with regard to the successes as a means or a pathway for others to follow in your experience and in the work you do with international psychology, in particular with women, for example?
Yeah, I think, well, women right now, I mean, if anyone follows the United Nations Sustainable Development Goals, one of the goals is gender equality and empowerment. I think that many parts of the world recognize that women can be leaders. Women can actually, although maybe not right out there, many of us actually are the anchor of families and communities. In some countries, actually, they're presidents who are women. So these are all the things. However, you know, this is a social construct. This was created by man who decided, or generations of that, women are lesser. So I mean, on that front, we're getting better, but it is also a human rights issue. And so a lot of the stuff that we do in international psychology addresses human rights, social justice, voice, flipping, right? All the inequities so that we can be equitable towards equality, and recognizing that what we do is not just one thing, right? So we learn. So here's what many of our students learn in core concepts, that we learn from the people. Okay, so we may have classes in psychology like international foundations and history of international psychology, acculturation and assimilation. Now that will be a very interesting class. I usually teach that class, theoretical perspectives in acculturation and assimilation, of like, how do we assimilate, right? This is based on John Barry's work on how do we assimilate, or do we even want to, in the dominant culture? Do we want to go to hospitals? Do we want to take certain medicines? Do we want natural healing? Or do we want to go back to what our ancestors have used? So as I mentioned to you before, I'm originally from the Philippines. However, I was raised by traditional Filipino parents, immigrated here to the United States. I have that background. And so the stuff, I was brought up learning their ways, right? My ways of healing. So who's to say my ways of healing and what my parents and their parents and their parents and their families taught them is not any better than what is presented here in the United States? This always is the big question for many of our students. And how do you teach that? So, I mean, the way that we teach it is through our study abroad courses that we have. We also teach it through exchanges like this, right? And students knowing that these are the type of learnings, because we as faculty also have to learn. I mean, we're not, just because we happen to be a faculty doesn't mean we know everything. We don't know anything at all, actually. So it's that orientation. Like everybody has been talking about it in a certain way, right? That orientation from a very low level of not assuming that we're going to go and in terms of well-being and treatment the same way everyone else is. And I know that's bad if we were all trained in like traditional counseling, medicine, and all of that. But where the world is going now in mental health and the world of diversity, equity, inclusion, which I do that type of work as well, global DEI work, is that we learn what makes sense for the community, because it's really arrogant of us to go into a community, like when I do global consultation or whatever, and they go, we would like X, Y, and Z. We would like to know how to do this and implement this. But then I'm thinking to myself, how arrogant am I to say, oh yeah, I can give you this model. You could do this. This is based on, Carl Rogers and Jay Haley or these people who developed their theoretical models and practice and all that in a totally different generation with a totally different population. And now we're expected to use it in a very collectivistic society. And so in some cultures, like in the Filipino culture, they'll just say, okay, yes, we'll do it because we think the West is best. What I'm saying to you is, sorry, the West is not best for a lot of things because it was created in a certain context and a certain generation when I wasn't even born. Okay, so that just like the Generation Z, right? Generation Z, like the kids now, they have a whole different type of life than when we were growing up. So wouldn't you think we would have different orientations and ways and reframing of mental health and well-being to meet with the times? So this is, yeah, go ahead.
Yeah. If I could, well, just to dovetail, I love what you're saying, and you're right on target. The different generation, the different orientation, the different cultural setting in the here and now, that speaks to and bespeaks to the idea of translating languages from one generation to another, from Carl Rogers to the medicine man and the white buffalo. And we're challenged with attempting to translate from like we're reading a scripture, or like we're reading the Sumerian tablets, from the Mesopotamia, and we want to update that to today's 5:30 news on ABC. And so how do you communicate that? How do you juxtapose that? How do you compare? Juxtaposing meaning, how do you contrast one with the other? And the idea of having, let's say, the Filipino culture with their own healing traditions, if you believe it, if it works, then Western medicine would be devastating. It would be poison for you because you don't believe it, because it hasn't worked, because it's not something that matches the context of how you think, feel, and recover. And anybody who does healing knows they have to translate and relate their method to the belief systems, to the culture, to the traditions, to the priorities of what that person's invested in. What does the word placebo mean to anybody? Okay. Have you ever heard of the placebo effect? If you believe the blue pill will make you smarter and the red pill will make you dumber, guess what happens if you have to take your SATs and you take the wrong color pill? Okay. It's going to devastate your belief system. And most healing is healing of belief. If you believe it, you can achieve it. And what do they say? If you conceive it, you can achieve it if you believe it. I mean, so you have that little rhythm going there. And if you label something the way it is, your whole mind, body, spirit aligns to that. So it's important to contextualize, to communicate, and to make sure we're talking individualistically to each person's language system. That's why if you can translate interrelated meanings, and sometimes, like they say, sometimes some things you can only say in French, you can't say in English. The term je ne sais quoi, you can only say that in French. And the translation doesn't make any sense in English. It says, it is not anything, which means it's something special because you can't really talk about it. But that's the challenge of capturing the Native American culture, the Filipino culture. Any culture has its own unique intrinsic meaning to it. I've ascribed a term in my world the concept of motif captures that in terms of its individualistic nature for each culture. If it can be translated, I don't think the assimilation doesn't mean losing your identity. It means finding a new expression of it in a larger context, preserving the unique nature of where people's origins are coming from. If it's not preserved, then it hasn't been conserved. It hasn't been done well. And that's the challenge. I mean, I know it gets general. It's hard to sometimes operationally define these terms because we have a short time and trying to capture a lot of comprehensive issues. But as a specific example, if what you've learned, Tricia, in the Philippines, and you've got a specific methodology and approach to healing, and that gets translated into a Western format, you haven't really assimilated it, you've differentiated it. You've found its unique way of connecting and integrating. This is not losing your identity, you're finding your identity.
This is a very interesting, very
Go ahead.
interesting point here, Dr. Feeny and Dr. Perez. I think this is a great segue. I want to get to questions, but before we do that, one of the great examples that we have that Serena brought up, and Serena, I want you to sort of chime in here and give a quick summary, if you will. It's one thing to treat, but you can't just treat and leave the person vacuous. You then have to replace. You have to plant new seeds. And in this world, what we're looking at here is putting those seeds of remembrance back into a forgotten culture. Serena, when you are doing your programs and with Dr. Feeny and with the American Indian Health Services, you're also looking to reintroduce your colleague Brian, for example, does work with drums. And Serena, would you just give us a quick synopsis of kind of the things you're doing to help individuals remember and to replace and to reinstitute those very important cultural root memories?
Well, since we work with the Native individuals here, and they're from all tribes, all nations, what we initially do is when I bring them in, I kind of get a history of where they're from, what tribe they're from, cultural teachings, things of that nature. Again, because we all practice something different, we have to ask permission for certain things. And so when I'm working with a client, let's just say somebody who will be discharged soon, his 59-year-old gentleman, he's relapsed 9 times. He's a 67-year-old gentleman. He's been drinking for about almost 59 years, he says. Relapsed about 9 times. He's got some health issues with diabetes and things, but he's been sober since he joined the program that I started, the Medicine Wheel 12 Steps. He's been sober now 161 days today, and he's been successful. And what he's doing is, what I'm showing him and suggesting to him is to implement new habits, good habits, with the bad ones. Whether that's being, changing your route that you go to work, or changing the route you go to a bus station, changing the way you walk your dog or where you walk your dog. Get up and smudge in the morning. Show gratitude for the day that you get to get up and you're sober today. I also implement smudging, which is something that we do to cleanse ourselves. We use different medicines for these things. And so we use sage to create that ambiance of positiveness. And that's where the culture comes in. But what I do in my programs with my patients is I implement living in 2 worlds, because we take the culture, we take those traditions, we take those teachings, and we implement it in today's world. How do we modernize that? How do we get these teachings? Well, we need to have more access to our sweat lodges. We need to have more access to practice these sun dances and ceremonies and such. Powwows, which we're having one by this weekend, if anybody's interested. We'll be at Bunker Hill.
Good plug, Serena. Good plug.
And implementing those things, again, and working with the individual person, because to each his own. Again, tribes, nations, different things, different treatments, different problems, different issues, different diagnosis. So again, we assess the situation. I sit down, I have them initially open up with a medicine wheel balance that they have to take home and really go through it. And it's color coded, and we have to see where the imbalance is at. So then we know where we need to work with them at. where we know they're here for recovery, to get sober, to get clean. But where is it really starting from? Where's it stemming from? We really have to chip away at that surface, and then get ourselves to that place. It's an ongoing journey again. And my patients, when I ask their input, how do they feel? Are they okay with trying this, something new? Again, implementing those good habits. Pick up a.
Uh-oh.
Serena, somehow you got muted.
I'm sorry.
There we go.
There you go. Sorry. Taking those negative habits that we did, because it was pretty much just a lot of time in our heads. So taking those thoughts creative. So what did you like to do? What would you like to try? Try something new. And again, it doesn't matter how old we are, try it, give it a shot. If you don't like it, you don't like it. How do you know you don't like it if you don't try it? So I kind of use that mentality too, along with humor. And, there is pain but what they leave here, when we finish our session, we smudge again, because I want them to leave it here. That's how we heal. We leave, we remove it.
This is a great example of contextual cultural healing. And I think that's what all of our panelists have really been talking about. Mr. Wells, I'd like us to get to questions. I believe we have a few that are sitting there before we run out of time.
Yeah,
and I want to thank all the panelists for your patience. But Mr. Wells, please, let's see if we can get in at least one question.
I was going to say that the questions are coming hot and heavy. And one thing that I wanted to kind of speak to very quickly as well, several universities have kind of moved to programs that are similar to the urban health program that I had described earlier, in which they're recruiting students to go into the health sciences from a lot of these underserved populations. And so my question, and Serena, perhaps you can speak to this most eloquently. Do your patients come to you expressing that they feel more comfortable working with someone from their own culture that can bring that cultural perspective to their healing process? And then to the rest of the panel, are you seeing this in your work as well, that folks are able to go to folks with a shared culture that makes their healing experience that much more effective?
If I may, really quick, I'll just keep it short for you guys. Definitely, it is something that I recommend for my patients to come in. I like that connection with them. I like to look at them in their eyes and just let them know that I'm really somebody who's been there. I really live this experience. And so not only just seeing us as an Indigenous, peer-to-peer, but having that lived experience and the comfortableness and the connection. Number one, the connection is important to me, and that's why I have them come in.
Beautiful.
Other panelists, anyone want to weigh in on the academic solution of recruiting folks from underserved communities into Western medical training programs?
Well, I think that's how they find us. I'm just saying, the international psychology, because we're the only one. We have a certificate, we have a master's program, and we have a doctoral program, and we have students from all over the world, and they want to research things that are developing issues, like a lot of qualitative research that they want to do. So, but I think that since we're the only degree-bearing program that does this, I think it's really more of our voices to be able, and people who are in these positions, I guess, of privilege and power in faculty and teaching, that they are able to voice that and again, have conversations that health can look very differently and also look very differently in conceptualization and application. So it really requires like one person, and that one person can change somebody else. Or I guess join our degree programs if you want to know more.
One thing I would share also is the idea of experience as opposed to academia. Many times when I started my own training, and perhaps Dr. Perez and maybe with Jeff and even Dr. Mensah, most of the work most people go into, I'm generalizing, so maybe it's not totally fair, comes from an experiential orientation. There's something in our experience that's motivating us to pursue something in the academics. It's very rare that people stay in this field who don't have an experiential drive that's moving them to do the discipline, the study, the exploring, the research, to live the examined life, to be willing to be humble, to be open to new learning. Just like Jeff is focusing on discoveries of nutrition, we also want to discover nutrition in a mind-body cultural way that supports the totality of the individual. To be open to new ideas, new adventures. It reminds me of the Star Trek experience, you know, in terms of go where no one's gone before. And really joining cultures, contrasting, complementing, differentiating, incorporating truly the unique intrinsic beauty of cultural integration and orientation has a kind of adventure to itself. There's an inner world that we haven't examined. Just like the ocean has been unexamined, the cultural identity of each individual hasn't been examined either. And if you look at epigenesis, the idea that learning is passed on from generation to generation, that has both a chemical and a Curlian electromagnetic plasma quality to it at the same time. So mind, body, spirit are aligned. One doesn't come without the other. You don't have a left side without a right side. You don't have a top without a bottom. There is that dialectical balance that occurs. If we can find that integration and pay attention to the individuality of how that person integrates with the culture and on an experiential level, this is something that has a dynamism to it. It's the devil's in the details, and if you can capture that individual precision, it's like a laser point. It just drives right through. And the resistance that Serena's talking about, helping people try things that are new and different, taps into that individuality from a cultural context. So that's the piece about keeping it both general and specific simultaneously.
Mr. Wells,
And
do
I
you
know
have any?
so go ahead.
I was going to say
Thank you,
that
Dr. Feeny.
so many of the questions that are coming in are less questions and more comments that are in essence agreeing with the conversation that this really does have to be an integrative approach, that that absolutely we need to be thinking not just mind, but mind, body, spirit, and culture and identity. So I think all of you have struck an important chord here in this discussion today.
I want to thank everyone, all of our panelists, and Serena for sharing your personal experience, for your commentaries and your insights. Jeff, this is one of those areas where when we talk about the Alaskan natives, that I think we have to really look to try more to incorporate a lot of these so to speak traditional pathways in addition to chemistry and so forth. But I view this conversation as an interesting model. I don't wish to focus purely on the native population to the exclusion of other populations, but I think it's a great example, one that most of us really don't think about, to be able to really sort of, I hate to put it this way, generalize to the broader populations of individual groups. We're not excising the Africans or the African Americans or the Latins or the Spaniards or any other groups that are here, but it talks about getting back to the actual culture and understanding of that culture for healing. It is our cultural experiences that allow us to fail in so many different domains, even in just everyday life. Someone's minor commentary becomes offensive to someone else because of the culture from which they come, and other individuals aren't aware of it. And before you know it, we have a fight on our hands because we've done this wonderful, well, we have this interesting experiment of a very multicultural continent here. And let's just focus on the United States of America. And in many ways, we suffer for the lack of exposure and the lack of understanding of our cultural colleagues, our neighbors, so to speak, even within a single block. But in terms of the true healing that must occur as we move through cases of trauma, of individuals who come to us with challenges, and those who don't come to us because they're afraid and they simply believe no one will understand them, we've got to change the paradigm. And this wonderful group that we have today, I want to thank Dr. Trish Perez again, and Dr. Feeny, and Mr. Maupin for coming, and Mr. Wells, and Serena, and your personal insights and expressions. Thank you all again. It's been a fabulous conversation, and one that we should have again.
May I
I
say
don't think we
something
have
really quick, Dr. Mensah, too, with the
Yes, please.
medicine wheels? If we're truly teaching about mental health and wellness and recovery, our medicine wheel teaches that we're all interconnected. So that's the east, west, south, and north, and that means all nations, all of us. So this is for truly humanity, this recovery.
Absolutely. I think we all agree with that one. Dr. Feeny?
Oh, absolutely, yes. And I'm a full subscriber to a multi-directional geography.
Indeed. All right.
Well,
Mr. Wells,
yes,
I turn it over to you.
absolutely. Thank you, everyone, for being with us today. Thank you for all of you who have tuned in and listened today with us live, and all of the wonderful comments and questions that have been a constant throughout this conversation. Additionally, thank you to those of you who are going to watch this later. I want to remind everyone that this webinar and all of our past webinars, all of the webinars that are part of the Integrative Mental Health Summit program that has been brought to you by the Mensah Research Institute and Journey's Dream. All of these webinars are available for review anytime on Journey's Dream's Amity platform. If you just go to journeysdream.org and look up Amity, you can find all of these webinars available. You can, if this conversation moved you and you want to share it with someone else, encourage them to go to journeysdream.org, look up the Amity platform, and find this webinar and all of our other webinars there as well. And of course, stay tuned, because we'll be coming back to you next month and in the months ahead with more important conversations leading up to our October conference in October 2022. Dr. Mensah, you have.
Now, as usual, I always have to interject, even though I've said, see you later, so to speak. I want everyone who views these discussions to please understand, our people are not just up here for show. There's a reason we brought Dr. Perez. There's a reason we brought Dr. Feeny. There's a reason we have Jeff here, Mr. Maupin. Please feel free to contact them if you have any difficulties, any challenges. Dr. Perez is a wonderful resource, and everyone here is like that tree with branches. They have connections, they have directions that they can give. Even if they can't help you directly themselves, they can give you good guidance to reach the individuals you need to reach. And, you know, especially with regard to our natives, if you're out there having difficulties or struggles, there's a guy in Chicago who works for a wonderful institution that is here to try to help. And there's an entire team. Inuits in Alaska, Jeff is there. Reach out, he'll provide help for you or guidance for you. And we'll do our best. The Mensah Mensah Research Institute, our goal is to try to help you find those individuals, those therapies. And that's what Journey's Dream is about. So please utilize those resources. If you have any questions, contact Mr. Wells, and he will get you moving in the right direction. Absolutely. Thank you, everyone, for your time and for dealing with my verbosity as usual.
Thank you very much, everybody. Thank you very much for the opportunity. Nice to meet everybody.
Yeah, it's a pleasure.
Thank you, Dr. Mensah. Thank you, Dr. Feeny.
Thank you, everyone.
Gotta get
Thank
to
you,
it.
Serena.
Thank
Dr.
you.
Perez,
Bye,
Jeff,
guys.
good to see you. Good to meet you.
Thank you.
Dr. Mensah, DJ.
Bye-bye.
Thank you again.
Bye-bye.